Welcome back to County Connection. For this next segment, we're going to be talking about Medicare, and here to enlighten us is TJ Dufresne, who is the SHIP Medicare Assistance Program Coordinator. Welcome, TJ.
Thank you very much for having me.
All right, so TJ, can you tell us what is SHIP, first of all?
Yeah, the SHIP Medicare Assistance Program is for people turning 65 or people that have already been in Social Security disability status. You will be automatically eligible for Medicare. And we help people with all things Medicare. It's very, very complicated, and the state and federal governments have funded us and basically contracted us at Northwest Colorado Council of Governments to implement and help people with all things. And most importantly, we need to make sure that you're not missing your enrollment periods and avoiding, in order to avoid the penalties that can accrue.
Great. And so, TJ, can you tell us a little bit about the organization that you work for and kind of how it's funded and structured, and what is your availability in Summit County?
Very good. So our program is out of the Northwest Colorado Council of Governments, and I consider it a consortium of government services. We have lots of different programs, mine being the Medicare Assistance Program in our Alpine Area Agency on Aging. I know that's a mouthful. We like to say the AAA, and some people call it Quad A, which is coordinating a lot of things aging, respite care, and all sorts of things. And so I'm in that umbrella. We also have Economic Development District. We have weatherization for low-income families who have a lease for over a year or own their home and they need weatherization. Elevator inspection is our only fee-based, so that's really great. But for my program, the Division of Insurance has given us a contract, or we accepted it, and we're funded by the federal and state. So we have to follow all of the federal guidelines, and our program is non-biased. We cannot tell you what plans to get, because then we'd be acting as a broker, but we can definitely help you narrow down all of your choices, and there are lots of different moving parts of Medicare, and we're here to help.
Excellent. So, yeah, like you said, lots of moving parts. Medicare can seem a little intimidating with all of the ins and outs. And so in the big picture, you're here to help folks understand all of the various options available to them. And then once they're in the program, then you still provide support in a variety of ways.
Yes, and one of the most important things we want everyone to do is compare the Part D drug plan every year. October 15th to December 7th, please be planning and do it early so that we're not scrambling near the end. But that's a time when you can change your drugs list on there, and you can also change your drug plan. When you change your drug plan, it will be effective January 1st of the next year. And we can also change an Part C Advantage plan if you've chosen to go in there. And then another really important element, when you're first eligible for Medicare, you have a choice between a Medigap supplement plan or going into a Part C Advantage plan to cover the 20% that Medicare does not cover after you do a claim.
Okay. And then you have a team, is that right, of folks who can help decipher all of these different options, as well as the particulars of the plan, what is paid for, what you need to do on your own, what kind of assistance is available. Is that right?
Yeah. And then one of the things that we have is also access to Medicare Savings Program, which helps with paying for Medicare or your costs. And our volunteers that we have currently, we have 2 certified volunteers in Summit County, and I do serve a 5-county region, and we have some more out in the community, but we are always looking for people that want to help with our newsletter, with data entry, becoming a certified counselor. It's actually very, very rewarding. People oftentimes tear up when they're saying goodbye because they're so appreciative. And then I usually take on the hard, really complicated ones. And then also I am the point person for fraud reporting. And those can be kind of tricky as well.
Okay. And what would you say for someone who is about to become eligible, so turning 65 or Social Security disability. So what are some of the key things that people need to be aware of?
Okay, so the first thing is that there is an enrollment period, and Medicare sends you a booklet that I have in my lap, and they say if you have that booklet, you knew the laws. So make sure that if you don't have help doing your enrollments, please get a hold of us. We can help with doing the basics, and we'll be having some community events for that, and we recommend people start about 3 months ahead so that they are slowly digesting. It's not unusual for people to come to our sessions 2 and 3 times even. And
so you need kind of the first time to let it wash over you, and
exactly
then to maybe revisit a little bit.
And some people get it right away. Other people are very nervous, and then they might get frustrated and stop, and then they end up with enrollment problems, and that can be really hard to fix.
Okay.
But as long as we're here to support you, just go ahead and use us, because that's why they've contracted us.
Right. That's why you're here.
Yeah, that's exactly it.
All right. So TJ, how do people connect with your team to get that support?
Very good. So here in Summit County, you can call the Senior Center and make an appointment with one of our volunteers. There's a book in there. I am looking for new counselors, so hopefully we'll have a lot more access after we partner with more of our community. Or you can call our program, 970-468-0295, extension 120. And then we can have a chat on the phone. And if people are computer savvy, oftentimes we can do a session over the phone. I'm in front of my computer, you're in front of yours, and we can get a lot of things done. And I can email documents that are pertinent that we might be talking about, and actually doing some of the enrollment for the drug plans and the Part C plans. The Medigap plans, you have to call the carriers.
Okay. All right, sounds great. Well, TJ, thanks so much for coming in today and letting us know about your services and giving us a little insight into that Medicare process.
Well, thank you so much. I appreciated your having us here.
All right. We're going to take a quick break, and when we come back, we're going to talk about expanded mental health programs here in Summit County.